Okay, so I will call the meeting to order. And we will take roll call. Jeffrey is here.
Yes.
Ralph Harrison,
Here.
Mike Norton,
Here.
Karen Powers.
Here.
Do I do staff too? Toby Vanden Heuvel,
Yep, here.
Dr. Miltnik,
He may be late. He had an urgent matter at the hospital.
Lois. Here. Oh, I'm sorry. And Paula McNeil. Approval of the minutes. If I could have a motion for someone to approve the minutes.
So moved, Madam Chair.
Second.
All in favor?
Aye.
Oh, comments about the minutes?
Can I make a comment? I just want a clarification because I'm not sure, I'm being new again. A lot of people asked me about the meeting that we had the last time. And on record, it said it was 1 hour and 22 minutes is what the meeting was. But the meeting was almost 2.5 to 3 hours. So I guess the only thing I'm questioning, I know the minutes, what's written here is about right. But I mean, on Zoom, it was off by a couple hours. So I don't know if this is a time where you would object to that, or you just, they don't worry about that. I'm just asking. Because it ended at 10:23 and it started at 7:30, so that's almost 3 hours. But on the record or on, they only said 1 hour and 22 minutes was recorded. So I'm just asking if this time you normally would object, but it's on Zoom, so I don't know if that counts the same as the minutes here. That's all I'm asking.
So if there's something wrong with our Zoom.
The minutes in last meetings, the Zoom recording button didn't start until late, and that's on us, and we were prepared for learning about this tech stuff. These are accurate to follow the conversation, but yes, that beginning part was lost. Right now, we are recording, we're good from the beginning, and we ask that that is now part of the process of starting, calling the order, that we make sure we hit record, and everybody's on the same page. New technology.
Okay, thank you.
We're gonna add that to the agenda for me.
Mhm.
Okay, thanks.
So all in favor of the minutes as written?
Aye.
Any negatives? Public comments.
Is it okay to speak here?
Yes, do you
Okay.
need his?
My
address?
name's Tom Hallquist. I practiced dentistry for 38 years in Oshkosh. I treated AIDS patients for 34. So I followed the issues on the viruses. So I'm kind of, after watching the meetings the last few years, I really want the board to listen to and respect their public health folks. I read 3 books on 4 books on the pandemic, books like Spillover, Deadliest Enemies, Animals, Viruses, and Humans. They were written between 2011 and 2018. And they make the point that we've increased in my lifetime the population of the country by 4 billion people. Those 4 billion people move into rural areas. They have more contacts with bats, more contacts with these animals that produce viruses. And we have 25 billion chickens, we have billions of pigs. So we have 4 billion more people interacting with billions of more animals that could produce a pathogen. And the COVID is not going to be the first pandemic or the last pandemic. But I have a paper that I'd just like to pass out, and it's on nothing to do with COVID, but everything to do with Russian disinformation. The Guardian in Britain, when Russia pivoted to the Ukraine war, 95% of COVID disinformation disappeared. We knew most of the COVID disinformation, most of the anti-vax sites, most of the anti-masking sites were Russian disinformation. We still didn't realize the absolute extent of it. And Scott Gottlieb's book, Uncontrolled Spread, and he was Trump's FDA commissioner, said we could have saved 3/4 of our population that died if we masked. Alpha and Delta only killed 12 people in Taiwan. They had a weekly mask allotment. And everybody had to wear it. It was $1,000 fine if you did. So, and so, and then, China, the pigs are gigafactories for viruses. They've lost over half their pigs to a hemorrhagic, African hemorrhagic virus. They had an H7N9, which is what our country's worried about, what our CDC is worried about. That never passed human to human, but when it passed bird to human, 1,500 people were infected, 600 died, over 30% kill rate. And that's what all these pandemic folks are worried about, is that really virulent flu virus. So when you have 6 healthcare professionals like mine get up and speak at a meeting, and you have 400 people that read the stuff put on anti-vax sites by Putin, the board has to stand up and say, I support the health department. I support, because there's 100 new variants of this Omicron, kind of Pentagon of 5 that is starting to spread. As long as it infects just the upper lungs, we're probably fairly safe versus the Alpha and Delta that really nailed the lower lungs and left 1 million people with long COVID that can't work. So it's not only the deaths, it's kind of the morbidity and mortality. So kind of the bottom line here is just read this article that I wrote on Russian disinformation. It has nothing to do with COVID, but it's extremely effective. Russia pays its disinformation people twice as much as anybody else. And their military used to be nuclear and conventional forces. Now it's nuclear, conventional, and cyber forces. And if you really want to understand Russia, there's a book called Putin's War, written in 2015. They talk about the hybrid war that's coming to Ukraine. It could have been written today. So, but thank you. But just please listen to your healthcare professionals. And but the paper will tell you how Russia, and they target conservative websites because Democrats aren't going to prioritize national defense. So if they can convince conservatives that something like climate change is not a problem, then they can run around the Arctic with 40 icebreakers. We have one. Run around the Arctic with 12 new warships. We don't oppose them. They have 7 of those 40 icebreakers to our one. 7 of them are nuclear. They're building a new class of super nuclear icebreakers. Nobody's opposing that. So, but thank you very much. But I just, kind of the last thing, Vermont, their Republican governor, he put his health department in charge of the COVID response, fairly strict protocols up front. He had the lowest death toll, he had the highest vaccination rate, and a little over 100 deaths per 100,000. Mississippi, with the worst response, has hit over 400 deaths per 100,000. So the public health department did, and he got re-elected by 40 points in a state Biden won by 35. People want to feel safe. So, so thank you very much.
I'm sorry, what was your last name?
Alquist.
Oh.
But we'll just pass these around.
Thank you.
Good night.
Thank you.
But Russia targets community leaders. The military worries because they target young officers.
Any other comments?
Is there anyone else on my side?
That's what I'm trying. Shelley, Bev, and Ashley just asked.
I just assume not do this in public, in the public comments thing, because that implies no response from the board. I would like to know when we vote on something in committee, such as the extending of the timeframe of temporary employees, how does that process work? I mean, who writes that up? And then does the final draft that gets presented to the board?
Well, most resolutions that are presented to you, if there's a standard process like a budget transfer or a table of organizational change, we'll typically have something written up for you to review and understand that.
I'm sorry, who?
Oh, I'll usually prepare those or draft those.
And you said for us to view, who's us?
The board. So anytime we have a resolution, the first stop is Board of Health. And so we would help assemble the information for you and also prepare an agenda item report to provide any additional clarifying information. And then those documents, start at Board of Health, and then they, if necessary, go to Personnel and Finance, and then to the full county board.
No, I think you misunderstood. So we voted on that increasing the time and then it was presented to the board. So that is you that write that draft that
Oh,
proposal?
so you mean after the board,
After we approved it?
Oh, so after we approved it, the agenda item report had continued to PNF, and then there was a vote on it, and then that continued to the county board, where that was made into a resolution by the clerk's office and clerk council. HR, of course, reviewed that, and then that's, part of your board packet. And now that that's passed, there's direction for HR in this situation to allow us to extend those project employees, our current project employees, beyond that 2-year limit.
So my problem with what happened on Tuesday is that we voted in committee to have a limit on that of June of next year, 2024. That was not mentioned to us on Tuesday. And then when you were questioned, you either denied knowledge of it or you didn't know that that actually was part of it. And I was wondering why that wasn't done. And number two is why you said there was no time limit.
So I apologize, and I got lost. I mean, I do
I can
recall,
understand that.
I do recall we had discussion on it. I think when we submitted our information for the resolution to be assembled, which is usually occurs outside of our office, that was not included.
Okay. Yeah, it kind of makes us look bad as a committee when we put something in there that's not included.
I agree that should have been included if that was our agreement. I'm sure the minutes reflect that.
Could we have changed it when we received the packet in the mail and read it? And if we would have noticed it then, would it have been too late to change it before the board meeting?
No, I mean, if there needed to be a correction, I mean, what we probably would have done is recognized at the board meeting because it had already passed PNF. And so it's going to be presented to the county board as it passed PNF, and then we would have amended it on the floor.
I don't remember.
I
We all did
remember
receive it.
because a lot of the board members were thinking that wasn't okay to drop that in forever. And I think that's where a lot of it was started out like, how long does this go? And we were talking before that I thought there was a limit. I thought we had a limit. And then when they asked you, said you didn't think there was one. So I couldn't answer because they kept on asking me, is there a limit? So I thought there was. We talked about it, but a lot of people didn't know that. They thought that by releasing that you let it go for a long time. And they were just worried about, will people be here 2 or 3 years from now?
There was certainly no intent to not include
Okay.
information that we all agreed on here.
So what you're saying, Doug, you passed something and then it got lost from here and then the corporation council's office, am I interpreting that correct?
Yeah, for some reason, when the resolution was written and it went to PNF, the time frame piece was left off. And this may have been a resolution that got delayed an extra month. And so it didn't go to the very next PNF meeting. So, yeah, I will definitely try to be more careful.
John's here, Connie, is that correct?
Madam Chairman, I guess to defend the staff a little bit, this is all a new process. When I got here a year and a half ago, we weren't doing agenda item reports. There were no draft resolutions that went to committee. It was pretty much fly by the seat of your pants. So I think what Doug's saying is that it was an honest mistake. There's a lot of moving parts. We are just now, my director Collard is finding his role as director of administration, so we can have a little bit of oversight on these things. We still had a couple misses for this board meeting. We had votes, counts that were wrong, that we had to change in the floor. So we're getting better with the process. That being said, to this specific resolution, the temporary employee, I think it's a board rule we have to look at. Because technically, if you have somebody, you need it for the entire project. Sometimes projects go longer than 2 years. These projects that we deal with government should last longer than 2 years, because we want to make sure we get it right. And the semantics of the rule is we could let people go and then rehire them for another 2-minute clock. And I think that was the main reason I support it, is you lose all that training. To defend Doug a little bit, yeah, it sounded like he made a mistake. It would have,
I would say it's on me, because I
sure,
should have reviewed it when it went to PNF and noted that that was missing.
Yeah.
From what we had discussed.
but it's still a new process, like recording meetings. There's been a lot of change in county government over the last year and a half. I think we're getting better, but thank you very much for those comments, because we need to know when we miss things, so we know what to look for. It's very helpful. I do appreciate that.
And I guess I wasn't really being accusatory, but then should this happen in the future?
Right.
I mean, I don't want to make you look bad in public at a meeting if that would happen, but
We all make mistakes.
then,
Should it happen in the future, the correct thing is to note it, and then you can make the amendment on the floor of the board.
Right, yeah, and especially if we know ahead of time, right when it's introduced, we can,
Mhm.
when, our chair introduces it, we can, just let it out right at that point, right up front. So please, yeah, if that looked like it was missing, I didn't hear from anybody that there was an error. I should have noted that that was missing. I didn't, and so I went through, and I guess, part of our challenge is that there's a lot of, we to have a deep discussion, understanding here. We forward our information for our next committee. The resolution documents get assembled elsewhere, and I should have taken a comparative look at that.
so then my procedure when I get there is I look at the, and I think it's wrong, I don't read the whole thing. I look at the headline, I said, well, we voted on this, and so obviously it's okay. That's as far as I go. And then you find out that, well, no, it was incomplete. And so then I didn't notice it until it was brought before the board that there was no time for that listed. So I wouldn't have noticed it ahead of time unless, I guess, I gotta read things. a
I
little
don't
better
know,
than
yeah.
you.
It was a big packet.
Yeah,
I don't know if any
I
of us
know what this
noticed it.
is. And the same with the other thing, I knew that was.
Right.
But turned out close enough.
No, thank you for pointing that out. No one noticed it apparently, because this is the first time we've even talked about it since then, so, thank you.
I just assumed it was not.
Any other public comments? Supervisor Norton has to leave at 8:30, so I don't know if that's going to affect the order that we want to do the business items.
I'm gonna be at 8:30 as well.
Okay,
There's no voting items today,
Okay.
so if you'd like to prioritize the agenda items that you guys want to make sure you get them first, that's fine.
if there's no voting items. So on to business director and staff update.
Yep, I'll start with just a quick update. One was our update from county board, so it's been 2 months since we met. We did have the 2 items. Go to county board. We're well aware of the project positions, just as a reminder. We have, this will affect up to 7 positions. Clearly, if people leave before their 2 years are up, or we don't need their services anymore, they won't be extended. The resolution doesn't allow us to hire another project employee and keep them beyond 2 years. It only affects those that are currently working for us. And so I would suspect that, well before our funding is over, we'll probably have cycled through those people, so. And I think one of the things that might have been lost, and that came up, at the county board is that, right now we have like 7, I don't have a tag in front of it. We have 7 staff impacted in total. I think we have about 27. We've got maybe 8 FTE currently in extra staff. But, previously in the pandemic, we doubled the size of our department, just to do response and cycle through all people. So, I mean, probably close to 50, if you believe right now, these numbers better than I do. Close to 50 extra people we had at any one given time during the pandemic, also reflect, an additional at least 80 or 90 total people that we've hired. So we're only keeping the staff that we need, and we're ramping down. Funding is, we're doing well with funding from the pandemic yet. We still have a significant amount of COVID funds that we can expend on these operations through 2024. So they've expanded the use of those funds to include our monkeypox response. We haven't needed much for that other than staff time. Because obviously, communicating with our community partners, advertising and setting up vaccination clinics, working with communities at higher risk. That's mostly staff time. I had 2 confirmed cases here. I think there's about roughly 80 to 85 cases so far in the state. And the Fox Valley has probably had, I'm guessing somewhere around a dozen cases, something like that. It was first. And then we'll continue to work with UW, and we're offering clinics here. So I'm getting a little ahead of myself here because we have time for my Fox update later. The other piece was the grant for doing the busing study. And so really understanding some of the pros and cons of offering free busing to families. There was just an article in the paper, right, on the kind of the negative side where, youth have been causing some trouble on the buses. And so those are all things that are really important to know when, a service like this is offered. So hopefully it's really helped get kids to school and increase their participation in school activities. Hopefully it's helped them outside of school, or help families that don't have better access to transportation. But we also know that, there may be some downsides to that free access to transportation as well.
Just one of our colleagues asked, when do you think that report will be done?
So that grant goes through the end of May of 2023. And we anticipate that there should be some community meetings to report back any of the results, as well as some handout brochures. I'm not coming up with the right word, that will be some written summaries of what we've learned as well. So end of next spring, early summer.
Could I ask about the 2 outbreaks you said in Winnebago County? Did there are some parameters that make people in high risk, and did those two individuals fall within that sort of high risk categories? Or is it very, very quite random?
Yeah, I couldn't tell you. I don't know the details of those 2 cases, and because it's just 2 cases, we wouldn't share that. We wouldn't share that level of detail anyway. So in typically when we have a very small number of cases of anything, we're really careful about what we release in terms of demographics to not unintentionally identify individuals specifically. So,
Okay.
If I could make
and there was two cases. Now I just want to clarify.
Yeah, two people, right?
In our county.
I can make a point of clarification back to the bus study. The board meeting, they asked, why not Nita and why not Menasha went out of the areas. And just to be clear, I want to let everybody else know this. It was only because that program for kids to ride free was in Oshkosh. So it wasn't that we were leaving other areas of the county out, is that we were just studying a free program, free ride program that Oshkosh did alone. It was a collaboration between the city of Oshkosh, the school district, and Go Transit, and I believe Oshkosh Corp paid $30,000 of the first year. Oh, and they're looking for community sponsors for the rest. It was supposed to be a 3-year study. Pandemic hit on year 2. So it kind of threw the numbers off a little bit. But I just want to be clear that we weren't leaving out other communities, that we're just studying a program that was done specifically in Oshkosh.
And then before we go to other reports, just a staffing update for the department. Currently still have an open environmental health specialist position. That's been an open application process. We are looking at interviewing 1 or 2 people, hopefully soon, because we've really had not many qualified applicants for that role at all. We have an open communicable disease supervisor position, which brings me to introduction, which I should have done earlier. Jackie Grigon is one of our communicable disease team nurses and has volunteered to step in on an interim role to fill in as CD supervisor during this difficult time. Since we have so much going on communicable disease wise, it's really important that we have that supervisor role in place. So thank you for helping us out, Jackie, and welcome to the group. So we're accepting applications for that position, and we'll schedule interviews as appropriate. Our policy and equity position remains vacant, and we'll have probably a separate discussion about that when we talk about next year's budget. So that's all I have on staffing, and I'll come back around on anything else, but I want to give our supervisors a chance to talk about their programming.
And so I know you guys like to hear about the new establishments. We have a couple of new establishments. The Popeyes coming in, Popeyes came in. New Mung grocery store, Fat Mama's open, Airbnb. We have a couple of food trucks that open. The underground, which used to be the French Quarter, open. We now have a mechanical bull, so if anybody wants to ride a mechanical bull, it's there, $5 a ride. We have a Dollar General in Larson that opened, and then Carrot Top Acres, which is just a farm meat stand. I was at Sturgeon Spirits on Wednesday. They're going to be a distillery of vodka, bourbon, and brandy, I think it was. And they're gonna have a tasting. So it's a cute little place.
Other distilleries and
Winnebago. This is our first distillery. This is the first distillery I expected in 38 years of my time doing this, so.
He's a UWO professor.
Yeah. Couple change of owner, they got big Apple Bagel change owners that do it in Oshkosh. We have a couple of new establishments coming in that we did planning reviews on for Dunkin' Donuts and Oshkosh. That's going to be where Packard Pub was. And then the schools, we reviewed kitchen plans for the new middle school and the new elementary school. I think that's going to is going to be. And our last large special event was the Monk Soccer Tournament. We had 22 temporary inspections that we completed for that event. That was one of our bigger events this year. Under environmental, 4 of our staff completed recertification for that risk assessor. That's required every 2 years to keep certifications with the state. And then our lead program, which is a new program, Scott continuing to reach out to landlords and tenants and getting properties enrolled. He's got 5 enrolled.
I have a quick question. Somebody asked me, could you provide a list of all the Airbnbs in this
Providing
county?
list of licensed Airbnbs.
What?
License.
License, yeah, you could do that. Sure.
Yeah, we can do that. Yeah.
All right. Thank you.
Unlicensed probably. So he's got 5 properties enrolled and approved. So we are just waiting for the specs to get written up for the work, and then that'll go out to the contract. He's finished his trainings, we had a lot of trainings, he already had the lead risk assessor, lead renovator who took, he's got lead worker and lead supervisor that's gonna be taking the next month or two.
Thanks, Dan. Yeah, as we get our feet on the ground with this lead program, we're having we have to develop this program from nothing. And as we get our first couple of properties through this process, we're gonna really need all the help we can get to promote the programming. We really want to enroll homes. The state and feds have funds available that we can use to make homes lead safe, to, increase our population of safe housing stock. And we're really gonna need contractors. That's gonna be probably the most rate limiting piece that we have, is that we don't have enough contractors to do lead safe work. And so what we will, as a part of our funding, we'll be offering free training for workers, so contractors can get their staff certified.
I have a question. I don't know if this is the right time to ask, but I like making sinkers, and so we would get a lead pipe from our plumbing friends.
Sure.
And I noticed at my last house that the supply line was still lead, which really surprised me. Is that enough to make that home unsafe?
So we have lead in paint, which is the primary cause of lead poisoning.
So more of the paint.
More than paint. Leaded water is a potential risk factor. It usually is a much smaller burden of lead. In a municipal water system, typically there's treatment, phosphate added to help minimize any leaching of lead from the inside of the pipes. In a rural area where you're on a well and you have a lead pipe, that's probably not happening. And testing is probably is a good idea in most situations if you're on a well. And then if there's any construction that's occurring. So if you live in the city of Oshkosh and there is street work being done in your area, that will potentially impact the pipes that are in the ground, and lead may then become into your water supply. I mean, things may come loose within the pipes. It moves through your plumbing system, and so those are always good times to test if you've had construction recently on your home, or there's been road work or other water work that's been done in the area.
But mostly paint.
Primarily, yeah. Not that there's no risk with lead pipes. It's typically a much smaller risk. And as we've been able to reduce the burden of lead in blood of children, it's becoming a larger issue, because now it's becoming, it's becoming more important, because we've done a really good job of bringing lead levels down. And that's just another contributing factor that we can now start looking at using resources to eliminate.
Kind of gets on that same line of thought. And this has been thinking about from years and years ago. As I recall, if you have lead pipes, or you suspect you have lead pipes in your house, that before you use water for any potable reason, you let water run for like 1 minute to clear out whatever may have been sitting in those lead pipes. Is that correct? That's what you're supposed to do, is let water run for a minute?
Yeah, I mean, if you have lead pipes, I mean, it's always never a bad idea to do a flush. Only drink from the cold tap, and then if your water's been sitting overnight or longer, do a flush, so that you're getting water that hasn't been sitting in your pipes all night.
Okay.
A lot of knowledge, Brad. Okay, Ashley?
Thank you. So I wanted to round back with a couple of quick updates of things we've been working on. This board approved the FAST grant over the summer, and the Solutions Rapid Response Team, which is what the FAST grant is funding, launched in early September. In their first month of business, so to speak, they had 228 total calls or contacts, 118 of those being unique individuals, which is huge for the first month, considering they were just rolling out to the Winnebago County Jail and NOVA counseling. They've since expanded to include Oshkosh EMS. They're going to be responding to non-fatal overdoses that don't get brought to the emergency department, since there's additional resources available at the emergency department. What they've been finding is that their peer support or recovery coaches are providing a lot of support, education, help with release planning, transportation to solutions for meetings or services, helping to establish recovery goals, and really reinforcing and supporting the Vivitrol program that the Sheriff's Department is running. They've noted that housing continues to be a difficulty that a lot of the people that they're serving are facing, as many of the emergency shelters and things have wait lists. Now that day by day is open, they may have some better options there, but that's what they're reporting back to us. Our Breakwater Coalition, which is our adolescence prevention coalition that runs our drug-free communities grant, launched a Be Courageous campaign in the Herald. So there's a link to that in the minutes of their stories, where they're really looking at encouraging adults and youth to talk about substances and giving adults some talking tools on how to do that. They also had a panel discussion at the Boys and Girls Club with several other community partners, and had some good feedback and responses from parents about how that panel went, and some kind of options for moving forward. We do know that moving into this time of year, closer to the holidays, we tend to see an increase in deaths by overdose in our community. And so we're offering additional free community Narcan training. So there's some dates up there. I can also add in some registration information. Those are going to be held through Zoom to make it really easy for anyone to participate. And then Narcan is always available at the health department for folks to come and pick up for free.
I have a question about the Narcan. To me, it seems like it's kind of insane to offer someone who's addicted to drugs the super availability of that stuff. So, okay, I can get high, and if I go too far with my boyfriend, it's gonna give me a shot. That might be good. And is that part of the training that, or as this becomes available, that we have some intervention of some kind to at least stop the habit in the first place, as opposed to provide them a way of not dying acutely?
So I think that here at the health department, we support a really broad range of substance use services, from primary prevention, which is what our adolescent substance use coalition is really looking at what are those primary preventative factors that can be increased in our community to stop kids from using substances in the first place, all the way through, trying to support treatment and recovery and harm reduction. And I think from that harm reduction standpoint, I can understand some of that concern of enabling and some of those sorts of things. But ultimately, what we're aiming for is that people don't die, because if they die, there's no option for recovery. And so things like Narcan and other harm reduction services give people time and space to get to a point that they can hopefully someday enter into recovery. And that's ultimately what Narcan is preventing people from dying.
I understand that. Yeah, my next door neighbor died from multiple overdoses, and he finally didn't make it. But earlier, they had the cops come by for underage drinking and left their breathalyzer by mistake. So then, these guys, and it was their thing to see how high they could blow. And so then part of the problem, I would think, is with Narcan, it'd be how high can I get before I don't die? And I was wondering if that was part of the issue that you guys might consider. It was like 32, by the way. They got pretty high.
I think it's worth noting too that for people in that situation who are users, it's not a decision necessarily that they rationally make, decide.
I can understand that too.
Those substances take over the rational thinking. And they drive that behavior more so than the actual decision.
And I think that's the point, that rational thinking is gone.
Yeah. So I don't think we can say that people are, weighing how high could I get? I think it's safe, I think I'll use this much, you know, that kind of thinking doesn't occur, it's those substances take over. So I think Narcan is a very good idea, because if they're gone, there's no way to rehabilitate them.
Madam Chair, may I speak? It's such a wide issue that we're facing right now. And I agree with Ashley, the point is to get people to recovery.
Correct.
Sometimes it takes 2 or 3 times through treatment before it finally kicks in. My brother was one of those. It's 2 years now. There's a lot of attempts for him to go. But I think that the broader point, the availability that we're seeing is it's not your typical what society would deem a drug user that are overdosing now. We're seeing fentanyl and Adderall, we're seeing fentanyl and Vicodin. Waukesha had the first case where somebody actually had an online prescription. The very first pill killed the person. It was Adderall, but was mixed with fentanyl. And they're trying to track down where that online provider was. He's somebody who had an actual prescription. So I think that's the concern that we're seeing. And in most places, these people are using in public places. I'm not sure if there's a Quick Trip that hasn't had an event in their bathroom, or many other restaurants or gas stations, and this is why we're trying to get them out there. Waukesha right now is teaming up with their high school. I don't know how you feel about this, their shop class, to actually make little Narcan boxes like they have AED boxes. Is AED, is that the correct thing for the? Yeah, right. Just for the availability, again, not to make it safe, because we're seeing this happen so much. And even you've heard of the dollar bills, you know, you don't pick up dollar bills anymore because people have used that. So in a parking lot, if there's a kid that picks up a dollar bill and goes unconscious, at least there's something for that too. So I don't want the idea of Narcan to go out as just for people that are using heroin or just for people that are using crystal meth. I mean, it's a very huge problem that seems to be getting worse by the day. And if there's any flaw in what I just said, please correct me. So ask the experts.
Well, on that line then, I'd be kind of curious, so I pick up a dollar bill and have an issue, who's gonna know that I need Narcan at that time?
Everybody around you, because you're gonna drop.
Oh, yeah, but then,
We're trained.
so how can you have that?
Because you're trained, because you're trained to know what to look for, because you're trained to know what the signs are. Much like we're having difficulties, right? Well, not, I wouldn't say difficulties, but we are constantly getting better with law enforcement to let them know what to look for when they go into a bedroom. Things to look for, things that 10 years ago we may have missed as an overdose, but now we know the signs to look for, and that's all part of the training. And that's why it's needed.
That makes sense.
The health department actually piloted Narcan with law enforcement, and found the funds to pay for the Narcan for the sheriff's department to carry. You know, they've been able to sustain that since then, but it was the work of public health that kept that rolling.
Jamie is not here.
Yep, Jamie was ill this morning, and really just very brief pronouncements for WIC. The public health emergency, which affects our WIC program, was extended until January. That means that WIC operations will likely remain more hybrid in terms of providing services. So people can come in if they want to, otherwise we provide services over the phone. And so we'll be revisiting that again next year at some point in time. And it's likely that we'll see probably some changes at the federal level of how WIC is administered from what we've learned in administering WIC in a more hybrid manner over the pandemic.
How long postpartum are women covered under WIC?
So pregnant women, I believe for 6 months, or as long as they're breastfeeding, there is benefit available.
Because people breastfeed away from 6 days to 6 years. I mean, how does a woman continue to qualify if she's a long-term breastfeeder? How does she just has to say, I'm still breastfeeding, or what is she, how does that go?
I believe there's a limit. I don't know off the top of my head.
Children until 5.
children till 5,
But
but
it's, so mothers aren't receiving the actual benefit themselves, the child until 5 is the one that's receiving the benefit.
Well, how long is the mother receiving benefit?
Mother receives benefit through her child, so mother pregnant, and then after the child's born, really the WIC supplement is mostly focused around the child.
Not on her nutritional needs.
During breastfeeding, we're
That's what I'm
assuming
asking.
6
How long-
to
how long-
2 years, so they,
How long?
6 months to 2 years is the average of what American women breastfeed, and so based on what they tell their dietitian when they're in the meeting, if they're using formula, what transition, they'll talk about what the best food is to have.
Okay. Thank you.
Yeah.
So our communication specialist continues to be very, very busy. That's Ashley Mukasa. She's working on, press releases, social media, website. She's also helping with updating our webpage. As you probably know, our county webpage went through a really nice transformation. And our website had a lot of information that during the transfer, the formatting so she's working very hard on that. Next week is National Lead Poisoning Prevention Week, so she works on those things as well as they come up. So she has been very, very busy. Feel free to look at some of the links, that she has provided. Our planner, Heidi Keating, is very busy working on the department's community health assessment. This is a requirement of our department. And right now, COVID sort of interrupted that work a little bit. So now she's really gung-ho working on that. And she's put together a very nice community health assessment advisory team, which is made up of community members. So part of her role is to make sure that community voices are included when we do a community health assessment. So she's very busy with that. Sarah Jean, our epidemiologist, continues to support the department and all the different divisions. And I would like to point out that in her first year as a full-time epidemiologist, she was instrumental and integral in starting the first state epidemiology network. So she got together with other epidemiologists in public health, and they formed this awesome group, and they share resources and information, and they have been presenting at different conferences. And they petitioned and requested the Wisconsin Public Health Association, which is our state parent association, to create an epidemiology section. So like a chapter in that organization, and they were approved. So we're very excited to see that work unfold. Shelley Brown-Giebel, our emergency preparedness specialist, continues to coordinate recurring COVID-19 clinics at Sunnyview, and also continues to coordinate vaccine clinics in partnership with schools, daycares, rural areas, trying to reach our most vulnerable folks that sometimes don't have transportation to come into Oshkosh, and working with other partners. She's also working with her counterparts in other counties on developing a public health response after action report. And then, of course, internally, she's, continues to update our plans, our continuity of operations and other plans that are very much needed. So that's all I have on my division. We're very busy.
Any questions? Online,
Jackie?
oh, Jackie's son.
Well, we'll start with the. We're reviewing our policies, procedures that we annually review annually, but many of them are written in a manner that is not the way, does not reflect how we currently use policy procedure. Things change, and as soon as they're supposed to change, we're expected to be utilizing those changes at the state level. So we need to be looking at our policy procedures and accessing them at the state level and be fluid in that change. Our policy doesn't need to change as much, but procedures do based on that. Beyond that, we have influenza clinics. We're expecting to have a bad season this year. We know that. We're looking at Australia's currently going through and Southern Hemisphere because they usually precede us. So we're trying to make sure that we're encouraging people to get their vaccine for flu vaccine, knowing that it's likely to hit us pretty hard. People have been exposed too much in the past 2 years either, so that will, the potential for that to get worse. We have noticed that our COVID outbreaks in our long-term care facilities have seen a uptick. There has been policy that came out from the state and from the CDC level for the long-term care facilities. Wondering if maybe that has some relationship with that, because now we're getting rid of screening and we're only doing testing based on outbreaks in the facility. If you're not screening, less likely to know until you have symptoms. And since they're that vulnerable population, that could be part of it, along with the data that we see a lot more of the open outbreaks in those long-term care facilities that tracking weekly. Any questions?
In a conversation I had with Doug, that informed me that we watch Australia this flu season to predict what we were doing. I guess I didn't realize that half the hemisphere was ahead or behind, who knows?
It's their winter. and
It's
our summer,
it's their winter, right? And it was pretty rough.
Yeah.
Their winter's been pretty rough, so we're expecting the same.
Tends to travel. Are very active around the world, so it comes quick.
Right.
Yeah, it's, and I thanks for bringing that up, because I was gonna add emphasis to that, because it's something we haven't talked about the last couple of years. The health department provides flu vaccine for county employees. We work in combination with the wellness committee to provide that. We really do not provide flu vaccine to the community because it's so accessible in the community, and any pharmacy you can get a flu shot at. We do need to probably step up our game a little bit on informing the community and helping create more of a sense of urgency this year on getting flu shots. Typically, only at most half, get vaccinated, and it's usually less. Just from the flu clinics that we've had here, county employees, what I'm hearing is that it's down from, the number of people that usually take them. So until we're done, we won't have those numbers, but we're looking at we're looking at a rough respiratory, virus season coming up. We're starting already. We're already seeing significant increases in other respiratory illnesses like rhinovirus and RSV. Flu is, we have a great surveillance system in Wisconsin. And so, we have our, we really know what's around, what we're seeing, but we do expect things to accelerate quickly and faster than the normal flu season. October is usually the month where we really push hard to get everybody vaccinated, anticipating a peak of flu, December to February timeframe, maybe a little earlier this year. But that in combination with what we expect to be an increase in COVID illnesses, like we're seeing in Europe right now. So like we follow, at least we've learned with coronavirus, what's happening in Western Europe, often is a predictor of what's coming our way. What we see in the Southern Hemisphere is coming our way for flu. We're in for both. And so the more people we can get vaccinated, the better. It's going to be a rough flu season, rough respiratory illness season.
Typically, we know that the last 2 weeks in January and the first week in February, it's our full long pattern. But last year, and we saw the pattern shift. But it's a concern. we're very fortunate that the schools keeping an eye on it, but at that point, it's too late.
What? Yeah.
What's going on?
Somebody needs to muted.
Make walk.
Oh,
I can make one comment in there too, that things that I've been noticing now that a lot of people that I know have been vaccinated and updated on process, and they're coming with COVID. That's a big thing now. I don't hear that much about it, and I always talk about the people that aren't vaccinated, but I'm looking at the flip side. There's a lot of my friends that have been vaccinated. They went to a weekend away and 7 or 8 of them came back with COVID, okay? One thing I noticed is that they're not really going to the doctor, they're getting their own tests at home. I don't know how you can find out any about that when they're testing at home.
Yeah.
They call their doctor and they get medication, they're being treated. Some of my friends have been sick for 10 days, some just a couple of days over, so. I think what happened a lot of times is when you come to the vaccination now, when you go for the flu, it's like, okay, the president just said that the COVID is over with, which is not true. And then also that, you know, I was supposed to get all these shots, so I wouldn't get COVID, I got it anyway. So now I think it hurts you a little bit when you're trying to get people to do a vaccination. Flu, I just went through this and it didn't do what it was, you know, I mean, in their heads and minds. And most, that's what they're talking. They weren't talking that before. They were talking so much, I gotta get that, I gotta get that. Now they're like second and third thoughts, like, I'm not sure I should be doing this. I was fine before, you know, and then one person that came to my house, my wife, he's a paramedic, he said he got COVID 5 times, and he's got all the shots, like, okay, so I mean, when you hear all that stuff, but that's the flip side, you know, I mean, they're testing at home, they're getting COVID, you're not getting any of that stuff, so you don't know where all that's going. Some are sick or something, and it just kind of, you know, I think it's just gonna make it tougher with the trust factor, you know, and I wrote that down here, because we're talking about, we want to trust the health department. But we gotta get out there and get on that stuff before, because that stuff you don't ever find out, like you said. These people are testing, they have it, they're talking amongst themselves, but that doesn't come in the reports or stuff for that. So that's another side, kind of like what I said before, is that, and I learned it from Lois when I was on my campaign trail, she taught me a lot about that, but there's just, and I said this before, there's 2 different sides or 3 different sides. We have to understand both sides. We just can't be on the side that we report that. We gotta get those people that haven't told us what happened to them, have been able to get stuff, or are doing this at home, or, and so now the first time when someone tells you that, you know, I had the vaccination and now I got COVID after I did everything I was supposed to. Now they told 5 or 6 people, now there's a thought in their mind, right? And I'm just saying the flip side. I mean, that's to me where a lot of times I think about this thing, we talk about what we're doing, but we've got those other things we don't know about. It's really important to do in data status, so we know the total picture, not this picture. That's just what I said. I understand what you're saying. But I'm out in public all the time. I do everything I can to volunteer. And I'm around a lot of people and I just hear all the stories. You guys can come with me and you get all that, because then they just throw up because they know who I'm at. But it's interesting because I'm not judging anything. Like you told me before, I want to learn as much as I can, but I want to learn all of it. I don't want to learn. Does that make sense? I mean, I don't want to just learn preventive and everything we did right. I want to learn about the stuff that we could have done or we should have done. What can we do to help somebody? Or I wrote down there again, like the health department has to show all the things we're doing. We're busier than heck. There's a lot going on. We need these people. We need this, but we have to get that more out there to get the trust. We just can't assume because of help where the trust is there. There's a lot of that now. They're second, third. And it doesn't matter. Like the gentleman said, Republican and Democrat, it's all over. You know what I mean? That's why I'm saying it's not political anymore. I think it's just people being people. So
Put you in a prime position.
Yeah.
To clarify, because those conversations, casual conversations, help. Once you're over 50, your body is no longer responds as well. And does not build up with attack, which is one of the benefits of being vaccinated. Because your body's been exposed to it, you're better able to fight it off when it comes. Doesn't mean you aren't going to get it, but you're going to build a better response. Instead of being sick for 2 months, you're less likely to have that length of time and hospitalized. You get through it in 10 days or 5 days. And so that's the thought process. It isn't that you're not going to get it, but if you do, your body's seen it before and it can fight it off better.
Thank you.
Yeah, I got exactly what you're saying. I'm not gonna go into it, but I'm a different example on the other side. And I said this before. I got my 4th cancer coming up. I had stents put in, I had hip surgery. I've been through everything that I should not be one of those, but I never got the shot. I had the COVID way back, a long time ago. I lost a friend that he was perfect and he got it, but they put him right on a ventilator in the hospital and that was it. They didn't do anything else because they didn't know it. So I mean, there's a story in there, but I understand where you're coming from, but I'm on the other side, the community, like we used to drink out of the dirty water, we did all that way before. So I mean, that's again, the section. But I'm safe with that. And I said it before, I had a flu shot one time free and I was sick for 14 days. I thought I was gone, and so I'm scared on that part. So, but I mean, there's different sides and I know what you're saying. I'm gonna tell you my age, but I'm older, so I should know better, like you said, okay? But I still believe a little bit about immunity, that we have natural immunity and things like that. And again, I wanted to talk about the whole picture, that we need to know everything. And that's why when we do all these reports or we do all these surveys and I think we got to make sure that we include everything. We don't just include the good stuff, the stuff we did, but what else is there out there that we missed? And you aren't going to find that unless you get out there. And people aren't going to voluntarily come to these meetings, unfortunately. So that's why we got to figure a way to get more of that information. That's why I was wondering when somebody said there's a group of local people. I wonder who those people are. Who's in that group? I think someone said there was a group that they're doing some research, but they have a community people.
The community health
I don't know who that
assessment.
is.
The community health assessment?
Yeah.
Yeah, so the community health assessment is a process that we have to go through. It's in our requirement as our statute, where we collect data.
Yeah.
Not only from the community, but also data from the census, like all these databases, right? To get a feel or a look at what are the primary health priorities or concerns in our community. And it's not necessarily diseases, like when we may say health, it's mental health, not just, cancer and diabetes and stuff like that, or health in terms of like the social determinants of health. So, our access to healthcare, are there barriers to accessing healthcare? So is transportation an issue? So health in the broadest of sense. So one of the things that Heidi is doing right now is she's convened a group of community members from representing all the county to help provide information that you wouldn't get from a database. Yep. So
Is there a lot of
it's not
people-
just COVID though.
No, but
just
is
to
there a
be-
lot of people on the committee, or I never really hear about who's on that or what's.
Yeah, well, it's a new committee. They've
Oh,
only
yeah,
met
it's not
like
yet.
twice or
Okay, that's
3
fine.
times. So, and it's representative of different subsets of the population in the community, so.
Sorry, we take it.
I think you bring up a good point, Ralph, the message, I think somehow the message about the COVID vaccines was missed a little bit. The COVID vaccine was never to prevent you from getting COVID. It was, should you get COVID, then your symptoms are likely to be a lot less.
Actually, I think that's incorrect. The initial instructions were going to prevent us from getting it, and it failed. And actually, the end result is, so we can fight on this forever. End result
So
is,
do you have good data?
I'm sorry, I was only halfway through my point, and then I'll answer your question afterwards. The end result is most people that are hospitalized now have been vaccinated. Most people are hospitalized for COVID. And it's a conversation that is going to happen in the future. Yes, sir.
So Eric Stolnick. So the question is, what would you postulated something that said that was wrong, the vaccine is not effective?
It is not.
Okay, so do you, so I'm curious about that. So if you have any additional information related to that, just if you could forward that on to the committee.
I'll forward it to you.
Sure, well, but I think, I mean, I'm guessing.
But anybody really, I'll do that.
Yeah, so,
It's endless.
If I could.
but I mean, if you look key data of where you're drawing your data from, I look at, I have a lot of patients who come in who say, I don't want to get the vaccine, I think the vaccine's wrong. Would you look at this? Would you look at that? Some of it's quite interesting. So, some of it has changed my mind on different things. So if you have, hey, this is where I'm looking at stuff, I think it's good. I think that that's something that a lot of times we don't have those discussions about. Okay, where is this data coming from and stuff like that? People will make these statements, it doesn't work. Well, so if you say, hey, it doesn't, this is where I found, this is where it doesn't work. That's great. And I mean, because I think obviously as a health department, we're standing behind, we're saying, come get our vaccine. We're holding clinics. Come get our vaccine. We're holding clinics. If it really is, hey, this doesn't work, why are we wasting our time doing that?
And correct me if I'm wrong, I think what he was saying is the perception in the beginning was the vaccine was going to prevent you from getting it. And that, whether that was what was claimed or not.
Anthony told us. was
Right, that was the
So that was the
perception
perception.
of the
It was
general
stated.
public, right?
Yeah.
And then people that had the vaccine were getting it. So I think that's not that he was necessarily saying it wasn't effective, but the perception was that if you were vaccinated, you were immune to it. And that kind of changed. And that's the problem, is that the civility went away. We had people that were very much for the vaccine that were shaming people that weren't. We had people that were not for the vaccine that were shaming people that were. And we lost a lot of really good tools through this because of emotion. I mean, you were talking about the last 2 weeks of January and the first 2 weeks of February would be a great time to advise high schools to wear a mask, and just in a regular flu season, not so much during the pandemic, because there were data points that it was effective. I mean, you think about the day-by-day warming shelter, we had one season finally where we didn't have everybody sick all winter. So there was clearly a thing. And we lost this ability for people when they are having a little bit of sniffles or a little bit of cold to wear a mask in general public, like we've always seen in hospitals. It's always for wear a mask if you're coughing or sneezing. It's something that we could have done in society that we were forced for so long to put them on our face that we've lost credibility in that. And we've lost civility in that. And somehow, and that is why I wanted to appoint such a diverse group to this board, is how do we come together and get that message? Like if you're comfortable with it, we want to make it as accessible for you. If you're not, we understand that too. We want to respect that. We don't want to shame you. But how do we get back to when we have a flu season that's wiping out half the students and half the faculty, that we could be okay saying, we're gonna recommend masks for these couple weeks while this is going. And can we get back there? Can we ever get back there to some kind of form of civility in this non-judgment world? I don't know. So, I appreciate the discussions. And I just want to make sure that everybody's clarifying points and that's the way we move forward.
I appreciate the comments. I think we learn as we go.
Yep.
We're dealing with ridiculously complex issues, vaccine, COVID. I mean, really understanding that it's quite complex. We're learning better language. Sometimes our expectations are too high, right? If we think vaccines prevent disease, that's wrong right out of the gate. I mean, in some cases, vaccines are very effective, but vaccines don't prevent anything. They train your body, right? It's your own immune system that prevents disease. It's not the vaccine. And so, that's just your personal trainer, right? I mean, you get that shot, it's your personal trainer. It helps you recognize something you've never seen before, and it helps your body respond to it. And in some instances, yeah, you might not have, because based on what your exposure was or what strain you were exposed to, you may or may not become ill. You're still likely to benefit from the vaccine in some way that's hard for us to measure. But yeah, it's not a magic pill, and vaccines don't prevent disease. Your body prevents disease.
And there are people who shouldn't like, if you look at the risk and benefit analysis, maybe they shouldn't. I've had those conversations with people and they say, hey, should I get the COVID vaccine? And I told them, I don't think you should, based on this or based on that. It's a very small subset of people, but I mean, I think that is something where it's like the universal messaging that maybe say, hey, you know, there's these people who should, there's these people who are kind of, maybe they'll benefit, and then there's probably people who maybe the risks outweigh the benefits, and how do we go about it?
Now, Alina.
Thank you.
All right, so hopefully you guys have noticed some media attention around childcare solutions, the big issue nationally, statewide, funding is coming in. It's alive here in Winnebago County, and there's different avenues. We've actually worked with the exec office, they've been contacted through Go EDC. And there's also the Dream Up grant. So there's a bunch of different collaborative areas. First Five Fox Valley is really our regional lead on childcare issues. They work very closely with the childcare, the Child Center Resource and Referral, and that serves the 5 communities. So they're the ones that know how many childcare centers we have, know the staffing issues, know the child numbers, and they're leading that conversation. The Women's Fund will be having a panel on December 6th, and they've asked the health department to come in and kind of talk about our data and what we've seen in the last 10 years. So just so that you're aware, we're connected with that, and there's some different initiatives. Some are more geared towards employees and employers and how they can support the childcare issues, and then others are coming from the training and staffing concerns. We have been piloting parent resource hours. I mentioned this in the past, Board of Health, but we've got some flyers in English and Spanish ready. So that is 2 locations per month, one in Oshkosh, one in Neenah. Anybody is eligible to come in and learn about the skills and tools that they need to be a better parent or caretaker. This is a way to revamp our maternal and child health care services that really were put on hold all through COVID. And we learned a lot of things about our staffing capacity when all of our nurses are pulled to do vaccinations and other types of contact disease needs. So we're working on that model, and because of that, we did recently write the grant and heard that we did receive funding for 2023 and into 2024. So I know that Doug was in a little bit of contact with the board earlier, but I'm not sure if you guys had the ability to actually read the full email and understand the content of the grant. I believe that when it comes to budget time, our best avenue is to try to bring it up as an amendment for the budget. Doug, do you want to explain a little bit more?
Yeah, and when we talk about budget planning.
Okay, we'll just bring that up then. So when we get there, this is what we're referencing. It will be paying for the staffing equipment to do our parent resource hours for the next 18 months. Well Woman program is doing well. We are fully staffed again, and after 2 years of really having hospitals and doctors' office over capacity, we're seeing those enrollment numbers not only return but really improve. We've had a goal of 30 per month, and in the last 4 months we've exceeded that, and it looks like we will again in October. We're already at 27. So that is alive and well. October is Breast Cancer Awareness Month, so there'll be pamphlets going out to our providers where really most of our referrals come from. Lastly, I wanted to mention for the Promoting Healthy Aging team, there's a lot of new Wellness Plus classes that are around our county, not just in Oshkosh. We've got a couple new classes starting in Winnebago and Menasha. This bit.ly will always bring you to the latest and greatest, most current class list. Lastly, we are teaming with City of Oshkosh Senior Center and ADRC to host a decades dinner. And so that is two residents of both ages 20s, 30s, 40s, but all the way up through 90s. So we are looking for a wide variety of folks to come together, sit around a table and have a meal and talk about what's important in your community, what challenges do you face, and really bridging that gap of how different our lives may have changed based on the decade that you grew up in. So if you are interested, please leave me your business card, and you don't have to tell me your exact age, but I do need to know the decade that you would fall in. we are asking that we won't be pulling any two people from the same household. So everybody there, you're gonna have to go and meet new people and talk about stuff that you're not quite sure, but you'll have a fun meal. It's sponsored by AARP, and they are really supporting our livable communities initiative, which is geared towards supporting a healthy aging, but with the auspice that when you're making things better for aging people, you're making it better for everyone. So get a hold of me if you're interested. Thank you.
Are you saying that people born in the 90s are old?
No, it's actually, if your age is in your 20s, if your age is in your 30s, so I'm actually looking for 90-year-olds.
Oh, I see. I thought these were just
Yes,
kids born.
I'll be
Okay.
looking for 90-year-olds that are interested in coming to this day.
And she's not
And
saying
I-
you're old, she's just saying.
I was been born. That's way younger than you.
This is connected with Parent Connection.
Parent Connection would be one of our partners that we would refer to as further, more inclusive training for parents.
Thank you.
Okay, very good, thank you. Shall we move on to the 2022 income statement review?
Yes, please, thank you. The income statement that I sent you with with the agenda is, the month closed after I sent that information, and so what you have in front of you here in hard copy is an updated income statement that's run through September. The finance month closes somewhere near the middle of the month, and based on what we're meeting, I can't always give you the most recent month, but now in this case, over the past week, we have. And so you have the most recent income statement for our department through September. Through September, we think, that's 9 months of the year. We should be at about 75% of budget. In addition to the actual income statement, Sir Jean, our epidemiologist, because I always complain that it's hard, reading an income statement isn't easy. When somebody just looks at an income statement for the first time, or if they're from the public, it's sometimes hard to make good sense of it. And so Sarah Jean is trying to provide a document that helps simplify reading the income statement, or pulls the information out of the income statement that you may find most relevant. And for me, the most relevant piece, or at least on the bigger scale, is, where are we at with our budget? If we're 9 months through the year and we should be at 75%, how do our revenues look comparison to that 75%? How do our expenses look to that 75%? And then how do the revenues and income compare? In other words, is one really ahead of the other? One of the issues we have with public health is that we have a large variety of funding sources, and I know you guys heard me say this 20 times probably, that we have a large variety of funding sources, and we have to fill a lot of grants. And we're typically 2 to 3 months behind on a lot of those grants. When I say behind, I think the process just takes that long. We incur the expenses, we submit an expense report for that budget. After that month's over, that has to get processed, and then we have to get checks sent back to us through the treasurer's office. So typically that process takes 2 to 3 months. So the revenues are always a little bit behind and look like we're behind. But just keep in mind that, add a couple months and that's probably about where we're at. In this case, for September, overall revenues are at 50% of budget. Overall expenses are at 57% of budget. So we're below budget. A lot of that is a COVID artifact from the large amount of COVID funds that have come into our agency. The take-home message there is that we haven't expended more than we've taken in, and that we still have a fair amount of room in our budget. And then you can see on revenue sources kind of where we're at in terms of the various larger categories, and same thing on the expense side. That the revenues and expenses are equal means that we're probably well under, because we still have money coming in up to 2 months late, 2+ months late. And so the budget is very healthy. This is really the take-home message here. And if you have any questions about any of the line items, we want to make sure that you have an opportunity to see how we code all of our expenses and revenues and ask questions related to that.
Mike added in the chat that he really likes the new format.
Does he? Okay.
I do too. This is awesome.
So if you have any recommendations or suggestions, I think this is all about making something that's a little more complex, a little more readable, pulling out those important points. And we're gonna have a Munis upgrade. I don't know if that's gonna mean we're gonna have, easier to read reports moving forward or not. But our goal is to make sure that you understand and that the community can also understand where we're at with our budget.
Much needed Munis upgrade. We are 5 generations of Munis behind.
Mhm.
And we are hopefully going to spend some money on some training for them to come in and show us how we're actually, how we can use the software that we have better.
And on to 2023 budget planning.
Last time we met, I shared what our departmental budget is. And since then, we've met with the county executive. The county executive has incorporated his feedback along with feedback from HR and IS to form his budget, the executive budget, which is now in your hands and either in a book or in a link, so that you know what is being presented by the county executive at the budget hearings, starting on the 31st of this month. There were a few changes from the department budget that you'll see in the county executive's budget. Most notably, we had a couple of position changes. We had an opportunity to request budget add-ons, and we requested a harm reduction position as an add-on to our budget. And the policy and equity position has been removed from our budget. John and I had a very long discussion about that. We feel that policy and equity is a very important part of our work. And I think there's concerns, and we've seen with equity being used as a term, one in our, one of our grants, got denied a couple months ago, because of concerns about CDC and equity. John has explained to me, and I don't need to speak for him since he's here, that he feels that the health department was, gonna have an issue with the equity position in budget, and that he felt the best thing to do right now was to remove that. John has also proposed, and may have discussed with some of you already, taking that position authority, so to speak, and adding an additional position in the department as a deputy director.
Yeah, if you don't mind, I'd like to explain a little bit
Go
more.
ahead.
So I had a policy decision to make on 2 positions. There was the equity and policy director in the health department, which I knew was going to have some issues during budget. Then I also had an educator position in UW Extension that was proposed to be an add-on. That was Mandy Dornfield's old position that supported the DAC and also was countywide. So I made the decision to pull the equity and policy director from the health department so that we could fund that educator position that goes with the health high schools. Historically, it does a lot of suicide awareness and some other things that are needed as well, and hopes to communicate or collaborate a little bit more. I guess I didn't realize the need of the policy end of it. Equity, we have to figure out a way to get to the discussion and let people know that wheelchairs are equity. That there's people that can't walk, that there's a way that it's not necessarily race connected to it, that it's something that it gives more access to people that don't have it. And then me and Doug talked about cut curbs. Is now in all your cities, you don't have these curbs on the corner. It's lowered so that you can get your wheelchair on there. Well, that's helped reduce trips and falls from aging population. It's made it easier for kids in rollerblades and other things to do it. So there's all these other advantages that came with it. And I didn't want to have that fight on the county board because there's already enough division, if you would. And I'm trying to be the peacemaker. One second. So afterwards, we talked about the policy piece, and well, Doug, explain to me the policy piece. And he said, this is somebody that listens to communities and sees what the things are coming up, so we could be aware of it, kind of coordinate with it. And to no fault of their own, public health has had to grow in a silo because we weren't working together well as a county when I got here. I mean, they had to make your own website. You had to do you had to make your own communications person. They had all these things that they've had to do within their own department because there wasn't really support from the county working together. So when I made the decision, I just figured the health department could work with that educator from UW Extension and still be able to work on some of the things that's important to them. And the policy director, as Doug explained it to me, is somebody to really see what's going on out in the community and the shareholders. Well, that's what I believe in, collaboration. So I want this to be a position that's actually going to help the health department work together with not only itself, but with other departments and other stakeholders in the community. So we can have the best bang for our buck that we're getting to actually affect change. Doug's position has been a lot of the things the health department traditionally have done in-house to expand to other providers and get some of those services out there where people can work together. It's not necessarily a tax levy. So I'm proposing an amendment to the budget that I've talked to a few of you about creating a deputy health director in our health department. And for many reasons, one of the things that I've been really focused on is leadership training and career paths. We have to build a bench. We have to build a bench in Winnebago County. We have to build our future leaders. And I think this is a position that can help do that. If we have something, maybe it's Janet, maybe it's Alana, maybe it's Ann back there that eventually, or Ashley, or Julia, that eventually want to consider being a health director here or in another county somewhere, to have that kind of transitional piece up for a little bit of career path and be able to build a bench and a higher paid position that could handle the duty of not only watching the policies in the community, but the collaboration with our partners. So I'm going to be in support of a deputy health director for a little bit more structure and a little bit higher pay, so that we can both have a little bit of career path in the health department and the county as a whole, and to really help to expand on collaboration within the county and with our stakeholders out there. Does that sum up?
Yeah.
Most of it.
We're talking internally about how to restructure some of the duties from that position. We have an internal equity team, we have an internal policy team. Health and health policies is a huge issue for public health. That's where a lot of our linkages with the community are. Having someone in-house to help analyze policy, to help make recommendations on health department policies is important. And so we'll continue to work on that. If a deputy director position is added, we will look at our administrative structure and how to most efficiently incorporate that position into health department operations and hopefully be able to accomplish the primary goals of that role without the title of equity in that role at this point in time. So we know that we're in a difficult time. It's really disappointing when we work hard to apply for grants to help improve our community, and then that funding gets rejected. At the county board, we'll continue to do that, but we're learning. We're learning what the concerns in the community are. We're learning how to better educate the community as to the role and function of public health, and we're really trying to help dispel some of the misperceptions that have been perpetuated that give people a negative reaction right out of the bat without even understanding what the work actually is.
And I would say it's not necessarily misconceptions. When you look at other parts of the country, and I think about Oakland did a universal income for families in poverty. They excluded Caucasians. You know, so when we see that, when we read those articles, and we realize when we talk in the health department of Winnebago County, when we say poverty, we mean poverty. We mean any minorities, we mean Caucasians, we mean everybody below the poverty line. It has nothing to do with race, has nothing to do with gender, has nothing to do with any of that. It's here is where you're struggling. How do we make sure that you're fed? How do we make sure that you have transportation to work and school? How do we make sure that you have the healthcare that you need? And that's where we need to get to. So I think the misperceptions piece is maybe a little bit off because we see what happens in other communities where it is being taken advantage of and maybe it is being used in a way that's not appropriate. I don't think we want to get there. You know, we want to make sure that we're talking about everybody who is suffering, no matter what it is that they're suffering from, whatever their inequity is, that we're addressing that.
I agree with our county executive. I think really it's not because you're black or queer or Mexican or white that we have issues. It's because you are in need. And I'm sure that nobody that is in need gets denied. And so that makes equity a nonsensical term. It should be need. And I would hope that none of these groups are denied ever. But they should not be getting care just because they are in this group if they don't need it either. So
Focus on the need, not the person.
that's correct.
Right. And we have a lot of need in Winnebago County.
That's right.
So technically, sorry.
It's okay. I just wanted to make a clarification because words matter. We never had an equity and policy director. It was an equity and policy specialist.
Okay.
Yep. Policy and equity coordinator.
Coordinator. So I don't want to elevate that position to
Sure.
something that it
All right.
wasn't.
Yep.
Okay, sorry.
And technically then, is the deputy director in the budget, or does someone need to fill out that yellow sheet of paper? And do we know how to fill it out? I can't do it, right? I
Yes.
won't be there.
Yes.
So I want to make sure that if we are going to do it, we have someone who's going to do it and they know how much it needs to be.
We are working on it administratively.
Okay.
So we will have that prepared for you. And why I wanted to discuss it here, because we don't believe discuss it here. But outside of here, I can contact each and every one of you to see if you want to be a sponsor on that. There is no quorum issues when I talk to supervisors. I just can't let you know what everybody else is thinking. But I'm absolutely capable of calling everybody. So I will do that and I will try to get as many sponsors then as possible. We've already ran the numbers. The only question we have is we don't know if we need the hardware for it.
Yeah, I think we're probably pretty good there, and I can make sure I round back on that.
Yeah, but we are going to be suggesting this is a grade 28 position.
So once again, technically, because
Yep.
you're both new, and do one of them need to bring it?
So I think the question is that, so John is county executive, I don't believe you can introduce an amendment.
I can do all the homework. I can't connect the terminals,
Right.
just like electricians at your house. You can run the wires, but you can't hook up the
Yeah,
outlet.
So what we need is a sponsor.
Right, so I will prepare the document for you. I'll make sure that it is okay for all of you. And then I'll be asking you to sponsor it. I cannot bring it forward, but it's something that I'm going to completely support, and administratively, we will do all the help we need to make it happen.
So with that, I mean, I have two other amendments that I'd like the board to hear out. And that might, how that flows may help you understand how this will flow.
Okay.
And so since we've done budget, we have received either a firm or a likely notification of additional funding. So Alana already mentioned the MCH grant. It's $150,000 for 2023 and 2024. It's $100,000 in 2023. So I'd like to have an amendment made at budget time to add that $100,000 into our budget for 2023. And I could provide more detail on that, and we could certainly provide the information and background and, copy of that grant and everything else. But we would need likely one of you to offer it up as an amendment to add to our budget. And the second is public health infrastructure funding that's starting to flow from the federal government to states. And so I'm expecting that before the end of the year, that we will likely be recipients of an award for public health infrastructure, and we can talk a little bit more about what that means, of about 410,000, 411,000 over a 5-year period. And what I would want to do is introduce an amendment for the portion of those funds that we might anticipate using in 2023. And so, so probably somewhere like around a quarter of that. As I get more information in the next few days or weeks, well, it can't be too long, we can create a budget transfer that shows how we would intend to use those funds in 2020. So those would be 2 amendments, and I'm asking for those amendments so that it saves us some time, and it also saves us from going through 3 committees to add that to next year's budget. Since we can do it, since we're doing the budget at the end of this month, we can simply add that now, and it's done for next year. Are there questions about that?
I have a couple.
Yep.
So are these like the things that we have where the money's come in and we have to approve in the board?
So you would, essentially, these would be, what I'm proposing is that we incorporate them into budget, to approve them as a part of the budget. The other option is, so like if I know I have a grant for next year, I'll have already put it in the budget for next year. And then when you approve the budget, you're approving the whole budget and all of the funding sources that are with it.
So we can skip that process.
So, right, yeah, so we can accelerate it.
Yeah, save us a couple, 3 hours.
Jeff, otherwise it's gonna be another resolution to debate in a further board meeting, right? Correct.
And so what I would like to do is work with at least one of you sponsoring that. And then it's in that, and Eric, I'm sorry, it's gonna have to be somebody, and Lois, and Toby, it has to be someone that's on the board to bring that forward.
And then, so I'm not gonna be there, so it has to be one of you, or Supervisor Norton or Powers, but do they need to write it up on that yellow sheet? Like, I'm all nervous about this yellow sheet that was put
Yeah.
up at the county board.
We will do everything to help support you. I just want to make sure that you understand it, that you're comfortable talking about it, that you have all the information you need to introduce it. And then, and of course, I'll be present to answer any questions to the extent possible. I'm not sure how the amendment process is going to work this year. Typically, and in the past, we really haven't had many amendments in public health. So I've usually been there for the county executive's presentation of his budget that reflects public health department, and then that's it. This year, because of amendments for the position and these 2 amendments, if you're willing to introduce them, I will certainly try to be there to answer any questions related to this.
And I just want to say how important that is. Number one, I am not part of the amendment process. I'm not allowed to speak or pretty much be at that meeting, and rightfully so. It has nothing to do with me. But the other thing that I would suggest is please use your director. You can have the director explain it if you're not comfortable doing it. You can ask him to bring it forward. But again, directors are not allowed to speak unless asked the question. So it's up to the health board members to ask the questions of your directors to get that input.
So that you're gonna produce these 3, and that's one way we do it, the budget.
Yep.
Now, I know I thought they said this last one, they were just gonna keep going.
Yeah.
Yep.
And then at the end, right, is that kind of,
Yeah.
is that at the end they'll come up with any of these extras?
So then will you be on call? Because you're not gonna know at what time
3
that
days.
happens.
Yeah.
Or us, I mean, do we have to be there at X amount of time when this comes up?
Yes.
So we're required to be there all 4 days.
Yeah, I
Or
will.
7.
Should be 3 days.
Oh, we're gonna get done before Thursday?
I think we can.
I don't know at this point,
I have faith.
so, and I can't take off work that many days, so.
Neither can I.
Oh, great. I'm not doing it. I'm doing celebration of lights all day, so I'm gonna take off those 3 days. The only thing is, again, it's all learning process.
Yeah.
It's okay. And, I was home after I got out, and I don't want to drag on everything, but I went through this whole thing and I'm thinking, okay, they say that you should trust your committees, which sometimes do and sometimes don't. They're all 7-0, 6-0, whatever, okay? That's one. Two, they've gone through each one of the budget places, each one has gone through the thought process, what they need, what they don't need. There's been a lot of time already. And then you went through your part. So when it's gone through 3 or 4 people, I just kind of amazes me that it takes 3 or 4 days to run it because pretty much everything is there except a couple of additions. I mean, you're arguing over spilled milk because it's already been argued, I'm sure, 3 committees, 4 people, a whole bunch of different people in that group. They've already come up with what they need. And I was able to sit in the health one and I was able to sit in the human services one. And it was pretty much cut and dried. We didn't have a lot of, we had a couple of, so there shouldn't be a lot, but I can't picture somebody, and it'll probably happen, some supervisor way over there that had nothing to do with anything is gonna say, why are we spending $2,000? Or, it's gonna come up, but you should trust your committees, you should trust people going through all this. And then this should be just a couple, 3. So that's why I said it takes 3 or 4 days. I mean, now we have 3 years, so I'm sure there's other ones. Because we talked about a couple things like vehicles instead. Now that's already in there, right?
Yep, those
So
are.
that we don't have to deal with. That's government.
Yeah, we're good on that board today.
Huh?
We're good on that board.
Yeah, okay. So yeah, if you give us all the information you're doing the work, I'll introduce it. We'll put together.
Like a co-sponsor.
Because you're not gonna be there.
Right.
And those 2 are.
Toby has a question
Oh,
or a
I'm sorry.
comment.
Yeah, I just, again, just want to put all the information on the table. Doug, where are these additional funds coming from? And do we need to have any discussion on that?
Yeah, so these are all flowing through DHS. The infrastructure funds are federal funds, so, at the federal level, there's been a recognition that public health is vastly underfunded. And so they made a commitment to try to increase funding and infrastructure in local health departments. And so we'll be offered that monies through the state. Fed has allocated money to states. DHS is makes the decisions on how those funds are allocated, how much is used for the state, how much of it flows to locals. And so that's where that's coming from. It's federal funds. The MCH grant, Alana, I know that's coming through DHS. I think I don't know if it's Title V or if it's Title V
Title
federal
V
funding.
extra.
Health and Human Services Department, and so that flows to states, and then states make decisions about how to utilize those funds, and it comes to us.
Title V has always been reserved for maternal and child health.
Does that help, Toby?
It does, and are there any expectations or say strings attached as far as how?
Yeah, there's
the money?
I don't believe there's any match commitment. So there's no expectation of additional use of local funds, which is usually the most significant concern. And I don't have the details on the infrastructure grant yet. We already have proposed how to use the MCH funds, internally in the health department and with partners. I'll be getting a little more information on the infrastructure. That can be used, I believe, for up to 5 years, and can support, it can support positions, programs, a wide variety of uses to bolster public health capacity within the community.
Okay, thank you. Yeah.
So those are 2 grants, and you give us all the information about them, what they're going, so we know that, right? Seems like, they'll come up with, do we need it for the money? Is there any catches, like you said? Next thing would probably be the CDC, is that connected? There's some office to get that word out of there, because that's kind of like poison word right now. Anyway, but so stuff like that, but yeah, whatever you can get us so we have a good presentation on it. But the only one that's really gonna be extra money is gonna be on the top, right? The deputies order. That's gonna come out of some fund. There's no money coming from anywhere else.
And it's replacing a position, so it's not the entirety is not an ad.
Okay,
There will be an additional funding, but most of that was already in there in the position.
okay. So,
There'll be a little confusion there, because right now it looks like we're position neutral because the harm reduction position is in there. we actually already have funding for that for most of next year. It's likely that we'll be able to identify additional funds to support that. But, and so, you know, in terms of, what we really want to do is establish that as a more permanent program for our community and expand harm reduction from just the health department. Right now, we're kind of the only show in town on a lot of that, and we need the capacity to make that more accessible elsewhere.
Probably so. What's a 28? I mean, I always hear these different levels that people get paid, right?
It's toward the top, so Doug is
Probably at 29, our supervisors are 27.
sevens, yep, you're 29. There's a few 30s and now 3 31s. So the 31s are Director Copel from Health and Human Services, Marianne Miller, Corporation Counsel, and now our Director of Administration.
So that coding is for everyone.
Right.
So doesn't matter if you work at highway, or everyone's get coded. the
We
same.
have grades, yep.
Because that pay has been a big thing too. You hear a lot of time about increases and that. And they talk about the numbers, but they don't talk about what they are. Even 27 is 26. I said, like, I have no idea what you're talking about. You know, I mean, I know it pretty soon we'll figure it out. So that's good. Okay. Thank you.
So I will propose, I'll help draft those documents and get back to you and look for one of you that will be there, hopefully to help sponsor that.
Are you gonna be there?
It can be, I think.
You're not at all.
Yeah, you can put my name on it, I just can't.
You can't.
You missed the
Oh,
entire
okay, you're
budget
not there,
process?
huh?
I'll be there for the nighttime.
Okay,
Okay.
it's my anniversary on the 1st, so I'm agreed to take my wife to Door County this weekend. She's like, you're not having a repeat of last year.
Well, could I just say, as a community member, I appreciate, well, your willingness to fill out the yellow piece of paper.
Well, I'm not doing the yellow paper.
I don't know.
We'll
Whatever
do it.
color-
You should.
whatever color
Okay,
it's
don't scare me now.
But I appreciate
I
that.
understand.
It's all just from my perspective. In my 30 years in public health, I always had a concern if we start not taking advantage of the funds that are offered. Over time, you're offered less because it appears that you don't need it. So, you know, I think it's a huge mistake not to take advantage of these things. So, thank you.
Any other comments, questions about the 2023 budget? And we shall move on to COVID-19 and money. Response.
Yep, I've kind of left this as a standing item, just to cover any issues that we don't talk about in the rest of the meeting. I think we've touched base on this quite a bit. I can just give you a quick overview of where we're at. We continue to offer vaccination clinics. Vaccine demand is rising with the new updated booster. It's certainly not being taken up by the community at the rate that we would really like to see it being taken up. So we're doing what we can to continue to promote that vaccine. We're still running our walk-in Wednesday clinic for vaccine. We have AMI, a state-supported team at Sunnyview on Thursdays. We go out to Fox Crossings on Tuesdays, I believe, and we're working with Allegheny County. I believe we're going to be establishing another site at Theta Care in Neenah as a location, and so that's a work in progress right now. Of course, pharmacies have vaccine. When that vaccine first became available, when I went out on CVS and Walgreens websites, you could get it. I mean, it wasn't like it wasn't available. There is, I mean, I had, an annual checkup about a little over a week ago, and they didn't have it. I mean, I got my flu shot, and I'm like, well, I'm on here. I asked them about it, and they were out. They didn't have it. So accessibility does vary by location and by institution, but it's certainly our goal to make it as accessible and easy to get as possible. If there's other opportunities that come up, we're more than willing to explore that. I think that when we talked about vaccine at the county board meeting and questions came up about vaccine, just want people to realize that offering of the vaccine is the public facing part of our work. And it's really the tip of the iceberg. I mean, there's a ton of planning that occurs with making those clinics happen. We need to, we need to advertise those clinics, we need to staff those clinics. We need to order vaccine with managed inventories. We have to, put every vaccine that we give into the Wisconsin Immunization Registry. And then we have all of the data tracking, the whole epidemiology side, the whole piece on community partners. It's just, there's so much work that goes into this. And what people just see is the vaccine. I mean, we didn't even talk about testing and, and all that. So I think maybe we take for granted how much effort goes into making vaccine available. Anyways, we know that vaccine uptake is lower than we'd like to be. We expect cases to rise. We are running a little blind, as Ralph, you mentioned earlier. People are home testing, so we don't have really good numbers. The vast majority, more than 90% of infections are not ones that we're aware of in terms of reporting. So we're going back to kind of what we used in the beginning of the pandemic before we had testing available. So we're looking at percent positivity of the tests that are done. We're looking at hospitalizations. So we're looking at other indicators to help us understand what the burden of disease in the community is right now. It's rising, and we expect it to rise through the fall as people are moving indoors and we have holidays. We're definitely expecting an increase in viral activity. Our messaging is really going to be focusing on people that are at risk, helping them take the protections that they need, continuing to promote vaccine. I'd really like to have a meeting coming up with UW system. I'd really love to see UW system, have a campaign related to flu and COVID vaccination. We know from past experience, that when the college age population is infected, it ripples through the whole community. And so anything we can do to reduce infections in these population centers will be helpful. Granted, it's hard to get the college age population to vaccinate because they feel invincible. And yes, they don't get super sick, but they spread it to a whole lot of other people. And so it's more about serving your community at that point or being a part of the community, in addition to protecting yourself. It's just that seniors obviously benefit a lot more from the vaccine. But if we don't expose them to begin with, obviously everybody's better off. So, and then monkeypox, we're running clinics every other week. We haven't seen huge uptake on vaccine. We are working with the university, trying to make more inroads with the LGBTQ community to help promote vaccine for those that are most at risk. And we'll continue those efforts. As I mentioned earlier, DHS has authorized us to use some of our COVID funds to also respond to the monkeypox outbreak. Roughly 85 cases in the state so far, 2 in Winnebago County. Hopefully we won't have many more. Any questions about any of that?
Excuse myself. The farmer's market, is that health department doing that?
Yeah.
All every week.
There's a combination. So we do the vaccine part. OASD partnered with us to do the front end during the summer. They helped, they maintain the booth outside of the movie theater, which is, what we use to do the vaccine. I don't know if there's anything else you want to share about that, Jackie. But yeah,
I just did that.
yes. And we don't have any more planned at the farmers market.
I can go indoors.
So we haven't made any plans at this point. If there's opportunity and it seems like a good place for us to be, then we certainly could explore that. I don't know if we did that in the last 2 years or not.
We do. I don't think it was.
I mean, we've had, we've been a part of either run or been a part of, around 400 clinic opportunities, and those continue. So I can't keep track of that.
Just a quick question, is there any sort of thought of whether those vaccines products will eventually end?
Yeah, we know that the federal government has, declared intent at some point here to stop offering free vaccine or paying for the vaccine. We don't know the timeline yet. We suspect that it'll probably be sometime next year. At that point, if we're not able to get vaccine for free, we probably will be forced to transition to a model of, like we have currently with flu, where we're relying on healthcare providers and pharmacies to provide vaccine, and insurance gets charged and that sort of thing. So we don't know exactly how that looks yet.
We definitely appreciate the efforts as far as from a healthcare provider standpoint of being able to, because like you said, our supplies have been fairly variable. They're gonna be, oh, we get it, and then we don't get it, and then we get it, and we have it, we don't. So having a steady supply is a good thing. I mean, that happens all the time, like with flu and stuff like that. I think it's just a little bit more seen with the chemicals.
And I think, one of the best things that we've done is had these long-standing sites, because people are coming back for their second doses, their booster doses. They know and trust, the Sunnyview Expo site particularly, and we get a lot of word of mouth from that. And so the seniors have really taken advantage of that.
Presentation?
We always have
Doesn't we have time for this?
Yeah, where are we at? We're at 27.
All right, so we're just gonna do, I know you guys have been waiting all meeting for this. That's the introduction to the environmental health division.
I think you can, but here we go.
So environmental health is a branch of public health. It's relationship between people and their environment, and it studies the physical, chemical, and biological factors in the environment that affect public health. Our environmental health division includes the sanitarian program, which is the licensing and inspection program, the environmental health program, which is all our complaints, our environmental issues, including childhood follow-up, and then our transient non-community water program, which is our DNA for the agent for the DNR for water inspection and sampling, and then our lead hazard reduction program. So our division has one supervisor and it has 4 specialists or sanitarians for the environmental health staff, and then we have 1 lead program coordinator. The job requirements is a 4-year science degree with a science emphasis. And then they have to become a registered sanitarian or a registered environmental health specialist within 2 years of hiring. And that state exam is similar to the state exam taken by the registered nurses to become a registered nurse. It encompasses all aspects of environmental health, and you have to pass with a 75% pass rate. So all of our staff currently, all of our staff currently have are certified registered sanitarians. I'm the only registered sanitarian because I'm old school. The other ones are all registered environmental health specialists. So we have a degree, we have 2 environmental health degrees from Eau Claire and Oshkosh. Both of those have the programs for the state. I have a degree in microbiology, public health, and then Morgan has a degree in community health. We have state certifications, like we talked about, the environmental health specialists, registered sanitarians. We're also all lead risk assessors, state certified and recertified every 2 years. And then for swimming pools and water facilities, there's the aquatic facility operator certification and certified pool operator certification. Those certifications are every 5 years. And then for our rabies, we have a certified rabies observer, so we can go and look at an animal to determine if they're having symptoms of rabies. Staff has experience between 5 years and 38 years. So, experience. About us, this is our lead abatement program. So Scott is our newest hire. He has a bachelor's of criminal justice, but he also has construction and project management experience, 22 years, and environmental investigation remediation work, and he did own a radar company. So he was a really good find for us. He has a construction background. He is getting certified on his lead risk assessors. He's got that, and he took the lead renovator course. He's held a home certification. He's got his radon mitigation certification, and he's got a couple of certifications scheduled. The lead supervisor is a 3-day course, and the lead abatement workers, I think a 1 or 2-day course. and then he'll be fully certified. The public health sanitarian is charged with protecting people from the environment factors that may affect health. These are just all the pictures in this presentation are either we have taken or they're off of a Facebook page from an establishment in our jurisdiction. So this is what we see. Green pool, just unorganized restaurant, mice, a well that's not properly doesn't meet code. So we'll start with the sanitarian program. So the sanitarian program, why is licensing are required? It's to ensure that all customers who pay for a food product receive one that is safe and wholesome. And then that food's made and sold, meet applicable state and federal regulatory standards. And then other establishments is to ensure they meet applicable codes and ensure public safety. Licenses are issued to a person or a company. They can't be transferred from location to location or person to person. So if somebody comes into a new restaurant and wants to take it over, they can't use the old license from the old establishment. They have to go through the process of getting the license. And our licenses run July 1st to June 30th. So it's a little bit over the licensing period. Our sanitarian program, the inspections, it's a minimum of one unannounced inspection per year. There are a few that, because of the establishment, we have to do it announced. But that's probably less than 5% of our inspections. We conduct risk-based inspections, so what risk is going to cause an issue with the public. Those are the statutes. Those are all the codes that we enforce. Each code is probably, well, our food code is 150 pages. So the other codes are probably about 20 to 30 pages. But our food code is the biggest code, and then is our biggest program. And then the top germs that we're trying to prevent outbreaks are norovirus, salmonella, Clostridium, and Candida. So we have about 1,029 licensed establishments. 821 of them are the retail food. So those are the restaurant, grocery stores, convenience stores, anything where there's food is sold. 74 water attractions, so pools, slides, splash pads, 71 hotels, any of our lodging, 29 campgrounds, and 24 body art, and then 10 mobile home communities. So we'll just go through a quick food inspection process. All our inspections are similar. This is our biggest program. So mainly what we do is we walk in, we introduce ourselves, we discuss, we find out who the person in charge is to make sure that there is somebody in charge that knows, what's going on in the restaurant. We do our hand washing ourselves to just show how important that it is. When we walk in the kitchen, we wash our hands. That also allows us to make sure that they have hot water at the hand wash sink, that they have soap and towels, that the sign is posted by their hand wash sink. All that's required by code. The inspection is dynamic, so we're watching food processes, we're watching how they're cutting, how they're cooling, how they're thawing foods. And we go into different areas of the kitchen and then we question employees about, how long do you cook this? What temperature do you cook this to? Just to gauge on how much the staff knows. And then we do stand around, I don't say stand around, but we do stand and observe staff just doing a process, just watching them. It's a learning opportunity for management staff, so we demonstrate. Sometimes if they don't know how to calibrate a thermometer, we show them how to calibrate a thermometer, how to set up the dishwashing sticks properly, how to test a dishwasher. A lot of times the dishwasher, the sanitizer isn't going through, so we show them how to prime the dishwasher, which they should know, but they don't. Proper use of test strips, and then we leave handouts, we leave signs, hand wash signs, dishwashing signs. Time to conduct an inspection is a half hour to sometimes 4+ hours. So figure a festival foods with the bakery, the deli, the meat, the general store, that's usually 4+ hours. A bigger restaurant, the hospital restaurants are usually about 4 hours. And then at the end, we do an exit interview with the manager or person in charge, going over what we find, our findings, and giving them a time period frame for corrections. The food code is based on the top top 10 factors contributing to foodborne outbreaks. So they really want us to hit these items, watching, how they're cold holding, how they're cooking, how they're cooling, things like that, hot holding. Automatic closing criteria, we don't have to close all that often, but automatic closing criteria is sewage backup into the kitchen, bathrooms. No electricity, of course, no running water or no hot water, or multiple critical violations during an inspection. This is just hand washing. You can see on the end, that's a hand wash sink. Not sure how they're gonna use that. So we do see things like that. Bare hand contact. So the rule is, you can't touch any ready-to-eat foods with your bare hands. It's not a glove rule, so you don't have to wear gloves. So if you can use a tongs, a tissue, a spatula, you don't have to wear gloves. So we look to watch how much bare hand contact is happening or not happening. And we discuss that. Most people wear gloves. The problem is when they wear the gloves, they get a false sense of security. They go and they touch the garbage and they go to the bathroom and, they do all kinds of stuff with gloves on because, gloves are gloves. They're not going to get contaminated. Then you charge them about that.
About the hair. I
Hairnet.
see a lot of people with hairnet, some do, some don't.
Yep, she probably has a hairnet on.
Oh.
Yep, so tied back hairnet. That's normally when I do an inspection, I have a hairnet on. Some of those were baseball caps, so baseball caps are allowed. Approved sources, so food cannot be made in a home kitchen. There are a few exemptions, but for any retail establishment, no home process. We see a lot in the bars where people make like dilly beans and salsa, and they come around to the bars and say, hey, I have these dilly beans for your Bloody Marys. Do you want to buy some? Well, no, that's totally not allowed, but we do find it in bars and mainly bars. They'll have a home, like the home can in their establishment. Wild game, game harvest in the wild is not an approved source. Only wild game from game farms is allowed. And then shellfish must be harvested in approved areas. And if they do have shellfish, they have to keep the shellfish tanks for 90 days. And that is for if there's an outbreak, then if somebody gets sick, they'll know which lot number those shells came from, so they can trace it back. So we've seen, the homemade pickled eggs, especially, around deer hunting, so wild mushrooms. We see, like I said, we see a lot of homemade dilly beans, homemade salsa in a lot of our bars. We look for separation and protection, so we want no raw meats over ready-to-eat foods. And we want them stored by the cooking temperatures of the food. So fish is cooked at 145, ground meat is 155, and poultry is 165. So if you have some juice from the ground meat that drops down to the poultry is going to be cooked the highest, and it'll kill any of the bacteria from any of the meats from above.
Excuse me?
How your refrigerator should be set up.
How your refrigerator should be set
No, I
up.
got you. Okay.
So these are a couple of refrigerators that we've seen. You can see on this one, there's some ground beef over some potatoes. And then that one I think is some meat or some meatballs over some open containers of potatoes or sauces. We see a lot of people, like you can see that one too, the Eco Lab. They're storing food in a chemical container. So, and like I said, these are pictures from our, date marking. So any ready-to-eat foods needs to be date marked for 7 days. Listeria is an organism of concern because it does grow in the refrigerator. It takes about 10 days to reach the level where it could cause a person to become ill. So that's why there's a 7-day date mark that food has to be used or discarded within 7 days. So this is just something that we found that you can tell is older than 7 days. And any foods missing date marks are thrown out. So just another one, rice. So
Does
that's,
this make you never want to go to a restaurant again?
We don't talk about that.
I've seen the worst of the worst.
yeah, exactly.
And that's, I mean, think about this for home too, right? When you have leftovers at home, how long you're keeping them, right?
So we talked a little bit about cooking temperature, same thing, poultry's cooked to 165, ground meat's 155, the seafood is 145, and pork is 135. And then anything else, any plant foods is 135. So cooling, there's special parameters for cooling. This is our #1 violation. Nobody knows how to cool things. So you want to cool from 135 to 70 within 2 hours. And then from 70 to 41 within an additional 4 hours, so a total of 6 hours of cooling. So it's shallow metal pans, food no higher than 2 inches in a pan. Don't cover it up until it's cooled. And then you want to stir it off with cooling wands. I was doing an inspection a couple of years ago. I went into a grocery store and there was that big plastic bucket of clam chowder. And when I went to temp it, I temped the middle of it, it was 70 degrees. And I asked the operator when this was put in the refrigerator. It was put in the refrigerator 18 hours before, and it was still 70 degrees because it was a thick liquid, it was in a plastic container, it was covered. So we proceeded to throw that away and teach them how to properly. Thawing foods, so you can thaw foods in the refrigerator, the microwave when cooking and under running water. You can see this fish is just sitting in it. Looks like a dishwashing sink, not under running water, so that's totally not good. And then any vacuum packaged fish, we make sure that they open the package when thawing. You want to break that vacuum package seal on that fish. This is just a hood that we've seen. It's a kitchen hood with grease filled up. Walk-in refrigerators, this is very common. Walk-in refrigerator icicles, they just don't deal with their maintenance. So you can see all the ice, the water's just dripping into the boxes of food on both sides, and then it's just dripping down from the condenser on the ice rocket ship or whatever. So this is a success picture. You should take more of these. This was the floor before. And then we ordered them to replace the floor, and that is the floor there. You can see the cooling of the water, bacteria grows in that. You can't clean the sharp edges, the rough edges. So yeah, so it turned out we did it. So that's good. And then pests, we have, it's not all that common that we see cockroaches. Very rarely do we see mice. And then that's just evidence of mice droppings. I think in the years that I've been doing it, I think I've seen mice 3 times in an establishment and cockroaches once. So it's very rare around here. Just a couple other wild pictures. So this is somebody, it's a do-it-yourself barbecue brush and some paintbrush on a wooden stick. So it doesn't need cold. Walk in. This is holding the condenser up with a paint can and a keg, and you can see just the disarray. So it's not, wow, yeah. Sewer line above a freezer. So if they do that, they can trough that with like a leaf trough. They can put a leaf trough under there. Just so if it leaks at all, it doesn't leak on top of the freezer. This is food not held at proper temperature. It's just sitting out at room temperature, not protected from contamination. Yeah, I don't even know where to start on this one.
Wow.
Just, yeah, a lot of stuff going on. And then our sturgeon spearing time, they usually put, these are usually on the pool tables. We see them bringing their sturgeon in, which is a sort of a funny picture. It happens a lot during sturgeon spearing. They'll wrap the pool table in a tarp and people can bring their sturgeon in. It doesn't really get behind the bar, so it's, you know, but technically, well, animals should be in a bar or any restaurant or food establishment, but. And then our restaurant reports can be found online. This is the website. All the state restaurant licenses, inspections are online. So our environmental health program, this deals with the hoarding issues, sewage, meth labs, pest housing, hazardous material. Rice, that we did rice in the past. Animal health is our rabies control program, control of or quarantine of animals. We send specimens to the state lab, usually bats that people find in their houses, that come into their houses. We do animal bite follow-up, quarantining animals for 10 days or depending on the vaccine status, up to 180 days. And then we do pet store grooming, salon, and kennel inspections. We also do lead poisoning prevention. We do assessments on houses of children under the age of 6 with elevated blood to determine the source of that. That's actually, I'm not sure what that is. That's a hoarding house, we're obviously a hoarding house, so. That's a cat hoarding house. 2 years ago, we had a house that had 100, I think it was, ended up being like 140 cats in the house. So we worked with the sheriff's department and some different humane societies to get those cats out. Just the backyard swimming pools, a lot of times we'll get complaints on those, that people don't keep them up and then they turn green and then the neighbors call because they're smelling. Bed bugs or, is a picture of bed bug, quite a few bed bug complaints and then just a little bad. The TNC program is the transient non-community water systems. It's establishments that serve 25 or more people 60 days of the year. So there are our rural taverns, our rural hotels, restaurants, and parks. We have 122 establishments. We sample the water for bacteria and nitrate annually. And then we inspect the drinking water system, the pressure tank, the filter, tank, the piping, all of that every 5 years. Let's say forms program, this is a new program, so it's conducted on properties to determine the location of the hazards that could potentially poison children. You can see on the one that says 315, all alligator paint, very deteriorated paint, even on the house there, you can see it's deteriorating. So that's what Scott would be looking at in his assessment. The lead hazard reduction and healthy homes grant looks at all of these items, the mold and moisture problems, electrical hazards, falls, spiders, radon. You know, it just goes through the house and just makes assessment on all of these factors. And then what help is provided with the grant, so it's assessment of the property, and then let's say for repairs, which may include windows, door sidings, and other repairs, to go from a lead issue to, after it's all fixed up and nice. For homeowners, the program pays 100% of the cost, and for landlords, it's 85 to 100% of the cost. And renters, there's no cost, so we're encouraging our renters to tell their landlords to apply for just a couple more pictures. That top upper picture is the 140 cat house. That bottom picture there, they were running propane heaters in the house because they had that's the electrical box, the corner ones. That's the electrical box to that one. Yeah, he had spliced the electrical box with some wires from the outside. And then this bottom one is just a hoarding issue, beer cans. That's a black toilet. Yeah, that is a toilet there. Yeah.
So what do we do in that case? Like, you don't kick people out of their own home.
Usually in cases like this, we're in the social services.
Okay.
So they usually, we'll order cleanup. A man's home is his castle pretty much. So they can live like that. Unless they can.
And if there's children involved.
And there's children, social services, for sure, they'll be involved. In fact, they're usually the ones that pull us in, social services, to help them.
And then
they take the children out to houses.
you said you do meth labs, do public police.
We get notified after the meth lab's been investigated by the med unit. So the med unit goes in, they pull all the chemicals out, they do a list of all the chemicals that were found, usually put on a tarp outside. And then we get called in to remediate the house. So, not that we haven't had one in a while, I just jinxed myself. We were involved in the Redmond incident and you know, a couple years ago. Because we had to take possession of the house after the state defense left. Yeah, and the FBI left, so that was very interesting. So any other questions?
Yeah, my neighbor is a hoarder outside a lot.
Oh, really?
Yeah, so the city is like doing nothing. I think they're afraid, the guys are back. Can the county step in and give the city a hand?
Well, we usually want the city to start,
Right.
because they are usually the ones that have more power.
how they do that. I figured the other way around.
Yeah, no, yeah.
Yeah,
So the answer is no.
If they ask us,
yeah, we can certainly talk to them, but typically, like in a city, like the city of Oshkosh, they're gonna have more ordinance authority to address that issue than we would. Because those local ordinances are really directly enforceable. A lot of times, we're writing, unless we have a specific ordinance for something, we're writing on state statute. And so then that's not a local court issue, it's a circuit court issue. We often try to work with, and I guess we have ordinances and things, but a lot of times it comes down to just working with people, developing a relationship. We may write a letter or, provide, some criteria or recommendations for this is what you should do. They may feel like orders, we might want them to feel like orders, but they're not, in order to move things along. And so, I mean, we may assist in, finding, we might call solid waste and ask if they can help us out with the dumpster, or, try to just engage family members that may not be really actively involved with someone. And, hoarding is a complex issue. And it's an issue that some people don't want to know about, or it's a behavior that will, no matter what you do, will persist. I think our goal is to make sure that the property is safe, that it's not a fire hazard, that it's not impacting children. And so, yeah, they're just complex. But we might be able to provide some suggestions or tips or provide some help.
When has lead been not used in paint? The 60s?
Yeah, I mean,
80s?
it was formally banned in 1978, as a like 0.06% or something like that of paint. We really saw a transition of lead out of paint, starting in about the 40s and 50s. By the 1960s, we really didn't see a whole lot. There's also lead in varnishes, other coatings that may be in a house, so there may be some surprises that way. But yeah, once you hit the 50s and 60s, it's either a lot lower concentration or just not used. So.
Thank you. Was this helpful? I thought it was.
Are there any new restaurants that are coming up that are exciting?
well, I don't know if it's exciting, we got Panda coming in, Panda Express. We have a Chipotle that, I don't know if I should post on that, but.
Yeah.
Plant Chipotle nut. Yeah, so,
Somebody said Primo's is sold now.
oh, yeah.
Yeah,
that's
so
the-
that-
there.
What's
the
that gonna be?
Chinese place, I think.
Chinese.
Sushi lovers, I think.
Oh,
Yay.
that's a big investment.
Yeah.
How about Golden Corral?
Oh, yeah, that's gonna be,
That's what Panda's gonna do, but they're not gonna, it's gonna not be in that building, it's gonna be like next to it. No, so I don't know if they're gonna do that.
What else?
Thanks for the important
That's more on your list.
you had some like a Fat Mom or something.
So Popeyes, right?
Oh, Popeyes is okay.
Lemon Grocery Store. I haven't stopped in there yet to see what that's all about. Their hours have been a little irregular.
Have they?
I don't know. I drive by there on the way in, and sometimes they're open, sometimes they're not.
We're supposed to have a little deli.
What is Fat Mama's? What's that?
It's a barbecue place on the corner of 7th and Ohio.
Is that taking the place of a different barbecue place? No.
She used to be, where Hot Dog Charlie's is, when she went out of business.
Sixth in Ohio, was that a different barbecue place?
Sixth and Ohio is up
Or
there.
third, or I'm trying to remember where. I thought there was a barbecue place on that
It's been like.
Oh, yeah.
But then he went, he moved, and he's got Uptown or whatever it's down.
So that's that.
Big guy.
So is there a restaurant that you're there like every other day? That we should
Not just
avoid?
reading either.
South on the line.
Wait,
But,
you
there are some that we will do more than a year. Or and then if you know, if it's bad, we do a so we give them a time to fix their violations, and we do a re-inspection. So. We don't just say, okay, you're all wrong, and then not come back for a year.
Oh, I
So we-
figured that.
yeah, we follow up until they correct it. So.
If you want some good Brazilian food, there's one in City Center that just opened. Really good, homemade, homemade Brazilian.
Maria's.
food. She's our neighbor,
Is she really?
Yep.
Yeah.
Mara's.
Mars. I mean, one last question. No. Right. Once a year?
Yeah, we try to once a year.
Once a year?
Yeah.
So that's kind of like. Over all that time.
A different manager,
Oh, okay.
that's what happens, it's a different manager, on staff, and doesn't come up, that just lets it,
Yeah, we can.
lets it get back.
This seems a lot of it's like common sense, who would live or do, or, you
Well,
know.
and how do you do like inventory when your kid looks like that?
Yeah.
You don't even know what you have, that's why we're finding moldy food, because you don't know what they have in there. So, I mean, the majority, this is like Doug said, this is like the worst of the worst. The majority of them are very good, very well run. You know, you always find something, whether it's temperature, cooling, like I said, cooling is the worst. That's the most important is food product.
And start a newsletter too, so we can get more information out to establishments, share information. I mean, we want these, I mean, we don't want people to cringe when the inspector walks in, right? We're hoping that they're also a resource for them. You know, they have so much knowledge because they see all of these establishments. And, you know, I mean, I feel part of our mission should be to help these businesses as much as we can. We want them to be successful. We want them to, you know, create jobs. You know, it's all related to everything we do. And, you know, the better they do, hopefully the better they do. And, you know,
And we have a lot of operators will reach out and they'll say, hey, I'm putting in a new, whatever, what do I need to do? So they'll call us before. So that's,
hopefully.
no, they do. There's a lot of them that do. There are. It's just easier for them to ask before than for us to come in and say, ooh, that's wrong. You're gonna have to, you know, get a new one. Or something.
Thanks, Dan.
Yeah, next meeting,
Yeah, so just, we talked about this last time too. As fast as I maybe think these meetings are gonna go, they always take longer. And so I guess I'll just throw it out there to offer, we have been meeting every other month, when there hasn't been a voting item. But our meetings have pretty consistently been running over 2 hours. You know, it's your meeting. We're happy to meet every month to share information and decrease the length of the meeting. So just want to make sure that's out there so that you guys can decide what you want to do. But we're happy to meet more frequently. If a shorter meeting is a little more desirable.
this next month with that,
And we,
all on Thanksgiving, or is that the month before?
So the third Friday.
and you know, we could have more of these kind of presentations, especially for the new folks.
Right, yeah.
So yeah, I would propose if we have a meeting next month that, we might want to move it up a week.
It would be the 18th, right?
That's not Thanksgiving, I think.
Yeah, that's not next year.
Yeah, would be the. Heading to deer hunting.
You're hunting
I'll miss
Which
it.
is Orange Friday, right?
Orange
That's what we talked about.
So then you're thinking November 11th.
That's up to you guys. I would probably not be here. Not that I couldn't try to connect by Zoom or something, but I don't expect any voting items. We would just give you updates on what's happened in the last month and another presentation.
Before December.
Or we can go to December.
I just assume go every other, do a longer meeting than every week and do a little shorter.
If we were to, it's up to you guys. If we go to December, we're looking at December 16th. And if we, I guess I've always, my goal in these meetings in the past has always been to try to keep it under 2 hours. Be out of here by 9:30, because I know people have to get to work and that's why I just want to make sure that we're accommodating everybody as best we can. I mean, my goal will still be to keep to 2 hours. We just end up having a longer discussion than, if we had not had a presentation, we would have been done about 9:30.
And I mean, we could have every month meeting for maybe 4 months and then go back to every other month or whatever. Change.
And for me, it's just, I want to ask questions. I mean, as a new supervisor, I just felt I wasn't asking, I was sitting there and doing my thing, but there's a lot of stuff. And then when you're on committees, more and more now they ask us, because they've been really preaching, committee, go by what the committee says. So people come over just before the meeting and says, okay, this has come up. What do you think about this? Where is it? So to get facts, it's easier. So more questions, we have answers, then they just don't issue it. It's not an issue anymore. So I think for us to be an educated board is important. I really do. Because to say this a lot of time in the freaking board meetings, it takes a long time as it is, right? No, yeah. But I mean, I know it. And the questions be good, because I really, I mean, as we get going, you ask the question, it kind of exposes some other stuff that people are sitting back not saying, I mean, really. A lot of times people, go, I'm not gonna say anything, I hope it does. And you can't learn if you're not saying something, if you're not involved. The more you get involved, this goes longer. I mean, I understand that. I was up at 5 o'clock, I'm just running around trying to figure out what to do next, And you have questions, and and you, even when you ask.
So as far as the next meeting, I'm hearing kind of a conflict of what we want, but should we do December? And then in December, if we want to go monthly after that, we can always go monthly after that.
That's it, yeah. Yeah, let's do December.
And then after that, maybe.
Just with
This
holidays
is
and
good
with
to
your
hear,
budget.
to know something, I mean, that tells you a lot.
Oh, yes,
Yeah. And I'm with Jeff, I mean, I think a little bit longer, maybe a little less often, actually probably works better than I said.
All right, I will not expect to necessarily be done in 2 hours then, and as we set up the agendas, and, we'll try to end, we'll see if we can try to end by 10 o'clock most days, because I want you to be able to plan around the meeting.
And I appreciate that.
Is that an issue for you, then, Rachel?
No, as long as I know, like I can plan, so.
We'll shoot for 7:30 to 10 for next month, or excuse me, for December, and then go from there.
Then we have Board of Health reports. Anybody have anything to report? Okay. And motion to adjourn the meeting,
I'm gonna adjourn.
I second it.
and then all in favor say aye.
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 Thank you.
The recording will stop.